Mental and physical well-being are increasingly being addressed in the workplace, but it is financial woes that are said to be an even greater issue in how happy or unhappy a person is, even for those in work.
I am a financial wellbeing expert, but today is about joining the dots between financial wellbeing, physical wellbeing, mental wellbeing. And I think a lot of these are quite siloed. People focus on one, not necessarily at the expense of the other, but not necessarily linking the three of them are interconnected. So I think today's quite a unique conference.
People looking at the physical well-being, looking at the mental well-being, and as I say, this new concept in terms of financial well-being. I thought there was needed in a conference. I'm not aware of a conference in Scotland that looked at the holistic approach.
We've got a range of different types of employers here today, ranging from food and drink to private schools to even the NHS, and we're hoping that they all leave today with some really good hints and tips as to how they can tackle some of these challenges within the workforce. We heard Macmillan Cancer talk about the impact of people who've got cancer but want to stay in the workplace and how challenging that can be.
Identification of such issues is key, and it is the bringing together of physical, mental and financial health and treating them as one that appears to be the key message.
To try to work and recognise the warning signs in the workforce and to deliver solutions. So today's a lot about education and also understanding what solutions are. We just heard from Mel Young talking about the Homeless World Cup. What a tremendous speaker he was, hearing about the impact he's had across the world. I mean, it really is tremendous to even hear about Scotland winning a World Cup. I mean, who would have thought?
So one of the things I cover later, actually, Cycle to Work is a good example of that, bringing it together in terms of the financial. If you cycle, you're going to save money. In terms of the physical, obviously keeps you fit but releases endorphins, and that helps your mental health well-being. So probably explains that three-pronged approach.
In this sense, medical and financial health is intrinsically linked, and this is increasingly causing a problem in itself.
Presenteeism is as big an issue as absenteeism, and the reality is presenteeism can have a worse effect on the workplace because it becomes a vicious cycle, and it can further worsen their own, whether it's a mental or financial or physical well-being issue. It can have an effect on the colleagues around them if they're not producing and their work's to a lower standard. So I mean, it's a real domino effect. They can recognise that, as I say, what the warning signs are, because it's not always obvious. And they talk about mental health being an invisible illness, and mental health issues are often a symptom of things like poor financial well-being.
And it is the invisibility of financial woes that make them as potent a threat as physical and mental ones. And the message here is that they should therefore be seen in the same way. Ian McNally, That's TV.